Welcome to the show, Dr. Neddermeyer. I want to ask you, I know a lot about hypnotherapy, but a lot of people don't. Can you explain to the audience a little bit about what hypnotherapist does?
Well, hypnosis is not anything different than what your mind already does. Your mind will go into that very narrow focus when you're reading or watching TV or driving a car or just maybe even doing laundry or dishes. And when you do that, you're focusing on something to the exclusion of everything out here. And all I do is just help you to narrow that down maybe a little deeper than what you do when you are just doing everyday things and not even being aware that that's what you're doing. So it's not something that's magic. It really is just a process. And the process can be used to take yourself back in time or forward in time or go to a specific experience that you've had and sort it out. Get all the information that you need to know and get into the feelings too, because that's really what causes distress from A to Z. All information that we have had or experiences that we've had is stored in the unconscious mind, and the unconscious mind wants to push it up into the conscious mind so that we can sort it out and resolve it.
Well, can false memories be put into the mind?
Well, the false memory syndrome, as I call it, has been tossed around for decades. And I personally don't think that it can be planted, and even the research that's been written about, I can poke holes in it, because there's a flaw there that you can't, if you know what hypnosis is all about, you can't refute. And I could, I could quote chapter and verse, but we don't have time for that.
Well, here's the thing about hypnotherapy. I think a lot of people don't understand it. They're afraid of it. Do you agree with that?
Oh, I think that probably most of the people are. Or they think it's just something very simple. They want to have something changed, but they don't want to have to do any work. But real hypnosis means that you are going to do the work to resolve whatever needs to be resolved. And you're also going to need to make a shift to bring in what you would rather be doing versus what you've been doing. And so there's really a process of taking out the old and putting in the new versus my giving you some post-hypnotic suggestions and saying, okay, now you're good to go.
Right. Well, can anybody fake this?
Fake?
Being
hypnotized? No, you can't. You might not get into a deep trance on the first try, but you can get into a very deep trance and you can't fake it. And even while I'm working, I can tell if you're starting to come out of the level of focus that I need you to be in, because when I do certain work, you need to be in a deeper focus or maybe just a light focus.
Can anyone be hypnotized?
Everyone can be hypnotized. Well, you hypnotize yourself all the time, because that's all it is your mind going to a narrow focus. And all I'm asking you is to just do a little more focus than what you would normally do.
Okay.
So everybody's mind can do that.
So what's the value in using hypnotherapy?
Well, the value is because you get transformation versus just a new habit. It's really a transformation from the mind, body, and spirit. And you can heal every diagnosis that anybody has ever had, from A to Z, and I call it abdominal pain to zits and everything in between, because we create it in our minds to begin with, and then we can uncreate it. And Louise Hay wrote the book, You Can Heal Your Body, based on the fact that you can change everything that you've created. Cancer, fibromyalgia, lupus, diabetes, cancer, breast cancer, it's from A to Z.
Here's the thing. I know, because I've worked with you, that hypnotherapy is not something where you just think it's just for smoking, weight loss. It's so much more, and how you go deep.
Mm-hmm.
When you talk about getting to the root, and I know a lot of people out there suffer with things, and it's past life
As well.
regression.
Yes, past life as well as this lifetime. Because when we come in for another lifetime in body, the soul is who you truly are. And when you come in body, you decide before you come, that soul incarnates, you decide what issues you want to resolve this time around. And then when you do the regression work, you're actually getting into the stuff that needs to be done because you're not being able to do it by yourself. Doesn't mean that you won't do it by yourself, but maybe you can't so far, or maybe you just need some help.
Well, I have to tell you, I was dealing with something very personal, and it was something that I didn't think anyone could help me with. I thought I was kind of a little nutty myself, and you came and you did a lecture at one of my events that I had put on, and you were sitting there talking about something that I said, this woman can help me. And I came to you, and it was awesome, and I never thought that I could be hypnotized. Within seconds, I'm telling you, within seconds I was out. But it was wonderful, and I did appreciate it because I didn't have to go that often, that long. I think people might think that they need to, and you truly did get into, I mean, deep into that layers. It was amazing.
Thank you for sharing that. I appreciate that because it is, you're saying exactly what everybody can experience, no matter how old you are. I think the youngest person I've had is 5. Because younger, it's a little more difficult because of the age, but even younger ones, you can do it as almost like a play therapy. And children can be mesmerized, or they can get into a focus very quickly. You can draw with them, or you can have them use toys, and it's very quick.
Well, I also want to talk about the difference between their stage hypnosis, which is not what you do at all.
Well, that's what most people think hypnosis is what they see on the stage. And on the stage, there's certain questions you ask people, and you can tell whether they would be gullible, is the best way to say it. So the people that are not gullible, they would say, oh, you're not an easy person to hypnotize, so we're not going to work with you. And so they've already screened out who they know is not going to go along with the gullibility that they need to have to get you to quack like a duck or cluck like a chicken.
Right. Well, you don't need to do that with Dr. D. I call you Dr. D.
Dr. D.
But when you come to you, it is just, you got to lay it all out on the table, and it is a conversation between you and whether it was with you and me or your patient or whatever, and it is probably one of the best work that I've ever done for myself, and I think that people need to give it a shot.
Well, thank you for that.
So if you're dealing with something, don't put it off. Give her a call.